Welcome everyone to our Raj webinar, which we hold every month. And we just have our goal of bringing very interesting insights to the whole tradition of Ayurveda, 6,000-year-old system of medicine from India that was recently revived in the 1980s through Maharishi Mahesh Yogi's Transcendental Meditation Organization and brought to the West. And my husband Rogers and I built the Raj, America's authentic Ayurveda health facility. We have, as said, been doing this for 35 years, and the Raj is a Ayurveda Panchakarma facility where we offer all 40 modalities of Ayurveda, including the Panchakarma therapies that are rejuvenating, address chronic disorders, and are very impressively uh, staged medical detox procedure, and very, very effective, with studies revealing that we can remove 50% of the body burden of environmental toxins in 5 days, published study. So today I'm very enthusiastic about our guest, Dr. Robert Schneider. Dr. Schneider is actually the medical director who oversees all our Ayurveda programs at the Raj. And Dr. Schneider is medical doctor, and he's also a fellow of the, it's called an FAC, of the American College of Cardiology, fellow of the American College of Cardiology. And this is an elected position, so it's quite an honor. And of course, Dr. Schneider is a physician, but a scientist physician, a researcher, professor, and internationally recognized leader in preventive cardiology and evidence-based integrative medicine. Robert's also the director of the Institute for Natural Medicine and Prevention at Maharishi International University here in Fairfield, Iowa, just down the street from the Raj. He has directed more than $25 million in NIH-funded research on transcendental meditation and stress reduction and cardiovascular health and aging. And he is the editor-in-chief of the forthcoming Oxford University Press textbook, Principles and Practice of Integrative Ayurveda. So today we're going to be discussing with Dr. Schneider, Maharishi Ayurveda and whole health. That includes mind, body, environment, and consciousness, and their relationship in the forefront of modern medicine. So this is what we love to look at, how this paradigm is shifting in the whole field of modern medicine to start to embrace the paradigm on which Ayurveda sits. Very different paradigm than modern medicine. And Robert is just an expert in this whole area. So Robert, welcome. We're just thrilled to have you with us today and ready to jump into a great conversation.
Thank you, Candace. Pleasure to be here with all of your friends and family.
And our listeners are definitely our friends and family, and many times people who are new to Ayurveda and the Raj and all these concepts we're talking about. So we have a very broad audience, and we welcome everyone, no matter what your background. We'll make it all very clear for everybody. So the thing that I am so fascinated about, and I'll start our discussion on this note, and that is, there is this text called Charaka Samhita, and it is the main text of Ayurveda. This is something that was written down 6,000 years ago. And what's so fascinating is to see how incredibly relevant it is today. Now, the reason it's relevant is because these are universal truths. This is a text that is explaining how to live a long life, how to live a healthy life, and how to live in accord with the laws of nature, with the rhythms and cycles of nature. Now, in this amazing text, oh, and by the way, just as an aside here, all these texts, Vedic texts, were written down. Most indigenous traditions were oral traditions. It was easy for them to become lost, but it was written down in Sanskrit. And Sanskrit is a living language. It exists today. It's not so much a spoken language, but it's an academic language with lots of experts who worked with Maharishi Mahesh Yogi to go back into these texts and restore it to its original integrity. So that the sentence that we're going to start out with today is some of the opening lines in this text. And one of them is that health, perfect health, is defined by being established in the self with a capital S. And this means allowing our individual awareness to open up to its universal reality, its cosmic reality. And this is the uniqueness of the human brain. So I would love Dr. Schneider Robert, to just jump right in and start talking about how this whole amazing body of health is connected to consciousness. Consciousness is the foundation of Ayurveda.
Excellent synopsis of the world's oldest tradition of health and knowledge. As you said, Ayurveda is written in this ancient language called Sanskrit. And the word in Sanskrit for health is swasthya. And as you said, swasthya means established in the self. It's also very much related to the word that many people are familiar with, yoga. Yoga in the original Sanskrit means union with oneself. Charak uses both of those words to describe the basis of health. And you could say that Charak, this ancient physician who wrote down these laws of nature, was the first psychosomatic physician, because he talked about how health of the body is dependent on health of the mind. Actually, they're interdependent. Mind and body both influence each other. And ultimately, the experience of the basis of the mind, the deepest level of the mind, this pure consciousness level, which he uses another word for in Sanskrit, it's called samadhi. Samadhi, also used in the yoga tradition and the Ayurveda tradition, which are very much the same expanded tradition, means transcending the ordinary thinking process, transcending the material body in terms of one's awareness, and in terms of our awareness, transcending even our ordinary thinking mind to experience our innermost self. Some people call this the level of, mind, body, spirit, or mind, body, consciousness, the innermost self. And in the theme of authentic tradition, we can use another word from Charak called Atma. Atma is the innermost universal self. And from this tradition, we can experience that level, and it's beyond ordinary thinking, expanded, unbounded. It's a state of deep rest, but also alertness. And from a medical or health point of view, that experience of restful alertness, which has those traditional terms, has all sorts of physiological changes that are associated with it. It took modern medicine until around the 1950s or around the 1960s to begin to acknowledge that the mind and body influence each other. In the Western science tradition, Descartes and those early philosophers separated the mind and the body. But more recently, in the modern tradition, it's been found that they've been connected. So this idea of meditation affecting not only mental health and physical health, and also the health of the people around us, social health is actually the next step in that understanding. which was the oldest understanding of health to begin with, now converging with modern
Right.
science.
No, it's fascinating how so much of today's modern medical research is coming back around to confirm these ancient principles, successor principles there in Ayurveda. Just things like epigenetics. Epigenetics says, okay, yes, you've got your genetic makeup, can't change it in a way, but you can influence it. And you can, by your lifestyle choices, you can turn off the weaker genes and switch on the stronger health supporting genes. So we can actually impact our genetic expression. So this comes right back to that amazing Ayurveda principle that um, your lifestyle choices are everything. As a matter of fact, one of the basic tenets of Ayurveda is you have a choice. So Ayurveda's one of its main roles as a preventative approach to health is to give everyone the information they need to be able to make those right choices in their daily life lifestyles in order to support health. So, anyway, as a researcher, I want to come back also to the amazing research that you have done that confirms that by allowing the mind to transcend the thinking process, not only do we expand our own consciousness from limited individual sense of identity to this big, expanded cosmic sense of identity, but we literally transform the physiology. So take it away.
Right. Yes, we've spent 40 years exploring that concept that you just mentioned. And it was inspired from several directions, but one direction was that there's a section of the Ayurvedic text where it talks about lifespan. It's actually the beginning and the end. The very beginning of the first textbook of Ayurveda is thus begins the quest for longevity. So all of that science. And then it talks about what is the purpose of living long. Why do you want to live long anyway? Do you want 10 years more of neurotic lifestyle or do you want something else?
Okay.
So it talks about enjoying relative values of life, accomplishing and achieving. It talks about enjoying pleasures of life, enjoyments of life. And it talks about right action, acting with meaning and purpose, and ultimately for liberation, for expansion of awareness, for self-actualization, one could say, in modern terms. So when I was a young medical student, I was very interested in the classic Ayurvedic literature, the classic Vedic literature, and how I could connect that with modern science and how we could have the two sciences informing each other and synergizing with each other. So I read that, and then also at the end of the textbook of Charak, the Ayurvedic textbook, it talks about just what you commented on: is lifespan fixed or not? And then it says, well, if lifespan is, it goes through this kind of a discussion or argument discussion. So one point of view, lifespan is fixed. And then the response is, if that's true, what's the purpose of this whole body of knowledge? Because this whole body of knowledge is to
Expand your life span.
maximizing lifespan and quality of life and health span. But it does acknowledge also the genetic component from past action or parents' actions or whatever. The genome is there, and that has an effect. But the Ayurvedic texts acknowledge that's not necessarily the main effect. And that corresponds with modern medicine, which talks about chronic diseases like heart disease may have 10 or 20% genetic contribution, but 80% is due to lifestyle and life choices.
Yeah.
So that inspired me is, okay, let's do something to maximize lifespan. Let's look at the ancient Vedic texts and let's look at modern science. From the modern science point of view, the number one cause of short life, of premature mortality, is heart disease. And my training in University of Michigan was in preventive cardiology, and it just happened to be the specialty of that center was the brain-heart connection. So I somehow got started in that area. And then the idea is that the mind, in physical form, the brain, has a very big contribution to the heart, to blood pressure, to heart disease, eventually to heart attack, stroke, and death. And then actually goes the other way around. And that also. So that's very much in line with the ancient perspective that the mind and heart are closely connected. And to attain health of one, you need the health of the other. So then I thought, okay, if the mind's important, modern medicine really at that time hadn't really discovered um, mind methods. This was a long time ago, but they were acknowledging the role of the mind in health, the role of the brain in health. And then I thought, okay, what technology are we going to use? And around that time, Maharishi was, of course, before that time, Maharishi was bringing out the knowledge of meditation, transcendental meditation. And he was saying from the very beginning that health of the body is dependent on health of the mind. And ultimately, the health depended on the health of the source of the mind, which he also said is the source of the body, this field of pure consciousness. But okay, that's there. What are we going to do with that? And how are we going to apply modern science to verify that using the language of the time, which is science? So then there was some early research suggesting that transcendental meditation had effects on breathing and heart, on blood pressure. And Dr. Wallace, Keith Wallace, published that in the early 1970s. And there I was at this Ivy League kind of institution who did all these fancy big studies called clinical trials, controlled, randomized. So I thought, let's apply that technology of rigorous science to this prediction. And that was in the 1980s, and we applied to the National Institutes of Health. We reported the data that had been before that, but no one had done these randomized, controlled trials, the kind of gold standard that drugs are tested on,
Right.
supposed to be tested on. So we did that, and we got the funding. And our first studies showed that the practice of transcendental meditation lowered blood pressure in older people at high risk and more than other forms of relaxation. We first tested a popular relaxation technique called progressive muscle relaxation, which is used in psychological settings, psychotherapy. And then we also had an education control. So we had three groups. They all had the same amount of time of instruction, same amount of time of whole practice, same expectancy. And then in that early work, which we published in one of the American Heart Association journals, we reported that transcending had was associated with lower blood pressure, and it was different from ordinary relaxation in terms of blood pressure reduction. And this was part of the original prediction too, that transcending, experiencing the state of deep rest and wakefulness, restful wakefulness, is relaxing for sure. It's relaxing and restful, but it's not falling asleep. There's something else is going on there, and that's the wakefulness side of things. That's the alertness. That's the self-healing, what seems to be physiological self-healing, cellular self-repair, homeostasis, and fancy medical words, they call it rebalancing of the system. So with that finding, we pursued it farther and farther over the years. Okay, what's the next step? What's the next step? What's the
Correct.
next step? We and others confirmed the blood pressure reducing effect. That's been replicated about 12 times now. And
So important that it's you can replicate it in
right,
the field of
right.
science. They put a
In
lot of merit on that.
in many different institutions, we and others have collaborated with top 10 medical centers in the United States. We were in Los Angeles at Cedars-Sinai and UCLA and Charles Drew, a historical minority institution, Columbia, University of Pennsylvania, Medical College of Wisconsin. Anyway, we've been all over to show that this is generalizable and replicable, as they call
Well, Robert, one comment here. Um, I think what's so interesting that a lot of people don't know, and that is that as you're describing, there's such extensive research on transcendental meditation, but what makes it unique? Because then many different meditation techniques have come on board and they are researched as well. But what makes our research so unique is the long-term hard measures. And so much of your research really established that you had those long-term big random control studies, but they're on hard measures. Now we have soft measures as well, and soft measures just means you use a questionnaire, that people, it's sort of their opinion. Are you feeling better? Are you feeling that your symptoms are improving, or your memory or whatever? Hard measures are stroke, heart attack, and death. These are hard measures. It's not someone's opinion. And in the same way with cortisol levels or any of these metabolic changes, signatures, or brainwave signatures, these are hard measures. It does not involve anyone's opinion. Because there's that placebo effect, oh, do you feel more mindful after you do this technique? Oh, yes, I think I do. But even those placebo effects are just opinions, you could even say, which may be also valid, but they can't be maintained over a long period of time. So then when you've got your long-term studies and your hard measure studies, now you have something that has a very scientific foundation. And I know that you really have been involved with so much of that kind of research that ultimately reveals transcendental meditation to be very unique in the mechanics of how it produces such a wide range of results, hard measures long term. And yeah, I wanted you to comment on that a little bit, if you will, because it does really move TM into Charaka's definition of what we have to do to expand consciousness and maintain long life. So take it away.
it. Yes, that was excellent preview of the field. Review and preview. In the area of medical research, there's they call it intermediate outcomes and long-term clinical outcomes, clinical endpoints, and then surrogates and mechanisms. So in terms of mechanisms, how does all this work? There are a number of neuroscientists who've studied brain effects of transcending EEG, brain imaging. We published something using a study using fMRI brain imaging. And it shows that unique sections of the brain kind of light up during this transcending experience, light up on the brain imaging. And then the EEG shows coherence between different parts of the brain, orderly functioning, and then synchrony between different parts of the brain. So a unified style of brain functioning is seen in the laboratory, EEG laboratory, and that's associated with this unified experience that people talk about subjectively and with that objective correlate. In terms of stress hormones, there are reductions in the stress hormones, cortisol, epinephrine, also known as adrenaline and noradrenaline, reduced sympathetic nervous system activity. People relate that to stress. When you get stressed, everything gets fast and active and turned up, and that system turns
Fight or
down.
flight. Is that the fight or flight
Fight or
response?
flight. Yeah, people say that. Yeah, yeah. And then there's a chronic fight or flight, which has is more cortisol when you're always on edge or always tense. But people who are depressed or angry, there's these three, and any kind of mental distress is associated with many of those changes. And many of those hormone changes are associated with damage in the arteries. Actually,
Right.
the more adrenaline you have circulating, it actually damages the lining of the arteries and causes buildup of this plaque on the inner arteries. And when that plaque or that kind of crust builds up, that's what causes blockage of the arteries. So there are a lot of experiments on the stress side. They have,
But that's so fascinating, Robert,
yeah,
that, uh, you know that sort of stress is correlated with health issues, but to see it directly correlated with the buildup of plaque in the arteries, that, that really brings it home that
mm,
everybody needs a stress management technology. So, um,
yes,
sorry about that.
that, that's That's absolutely right. So that these two fields in medicine have developed in parallel and now have come together. One stream in modern medicine that started out with type A behavior many years ago, which is a form of psychological stress associated with heart disease. Then it moved on to other psychological characteristics, and now most forms of psychological stress, PTSD, depression, even social stress, social determinants of health, living in a stressful environment contributes to damage in one's arteries. So that's been one track. And then this idea, let's do something about it. Let's do something to reduce the consequences of stress has been a parallel track. And that's what we've done over the years. And we've shown reductions in the endpoints of this mind-heart connection. The endpoints are, we talked about longevity. So how long you live. Do people live longer and then they stay out of the hospital? And it's difficult to argue with the death certificate as being related to placebo or not. So
Right. Good point. Good
that's
point.
the so we followed our subjects for 5 to 10 years. Took a long time to do these studies,
Yeah.
but after 10 years, we found in 3 studies, now 3 independent publications in peer-reviewed journals, that there's a reduction in the combination of these clinical events of mortality, MI, and stroke, which are all undisputable endpoints. And there's around a 40% reduction, 40 to 50% reduction in these events over between 5 and 10 years,
That's
which
really
is
significant. Really.
which is the same or greater than the effects of conventional drugs. Uh, Lipid lowering drugs that are very common drugs used in heart disease prevention. Blood pressure lowering drugs are another category. We're also looking at another category now, anti-inflammation drugs as a way to reduce. So, and funnily enough, or not, interestingly enough, antidepressant drugs have not been associated with longer life or less heart disease, although there may be effects on mental health from those and other treatments. The effects on the body have not been shown. Anyway, so this mind body consciousness based intervention in these studies has an effect that's clinically significant, as effective as conventional drugs. We're not saying that people should stop their conventional drugs. We're saying as an adjunct to conventional care, people continue to see their doctors. But this uh, is is something that has this major clinical effect.
Yeah,
We
but
can't,
I think also it is the case that a lot of people have been under doctor's care, been able to go off medications using transcendental meditation. So that's a great thing too, because inevitably, so much of the pharmaceutical medications have harmful side effects. So, and I think that's the great gift of Ayurveda is addressing chronic disorders and coming from a strong prevention angle. And prevention here meaning not just early detection of disease, not just early intervention, but actually preventing disease from arising in the first place. So I think that this this the harmful side effects of so many pharmaceutical drugs, it's a big issue today. And it's a fascinating insight from the perspective of Ayurveda on why these harmful side effects arise, because all pharmaceutical medicine, pretty much almost all, is derived from plants. So there you see again this incredible connection between us, the human, and our human body, and the rest of the physical world. We're all made up of the same stuff. We're all made up of the same atoms and subatomic particles and molecules, and we are all subject to the same laws of nature. So when you see this connection, that we find healing substances for the body in the natural world around us, and we find the same healing intelligence present in a plant as it is in the human body, and that the intelligence in the plant can activate the intelligence in the body. But the problem is with the pharmaceutical companies, they want to patent the drug, and you can't patent a plant. So they identify the active ingredient in the plant. They chemically then extract that active ingredient. Then they chemically reproduce that ingredient. And now they make a drug. They make aspirin out of the active ingredient in willow bark. But the problem is you have separated that active ingredient from all the other aspects of that plant that work synergistically. So you've removed it from the holistic intelligence, then you chemically reproduce it. And as a result, it has its curative properties, but it has harmful side effects. And I think that was one of the motivating factors when that came out in the 1980s, that actually modern medicine was the third leading cause of death in the United States. There was a published paper on this. That was when Maharishi's feeling was, we have to revive Ayurveda so that we can allow people to take their health and their happiness back into their own hands. So everything you're explaining here, Robert, it's so important, it's so valuable for people to understand that some of these simple mind-body technologies, transcendental meditation, can have the same effect or actually a better effect because of all the positive side effects. So not only are we addressing, say, cardiology or high blood pressure, but there's a huge range of other positive side effects that you're getting along with that practice. Whereas, say, with the statin drugs or whatever drug you're taking for your high blood pressure, other drugs, whatever they may be, you get the harmful side effects that come along with it. So again, an ancient system of medicine addressing modern concerns today for prevention and treatment of chronic disorder. Or we could say addressing chronic disorder if we want to be a little bit more careful in our terminology. But please comment on.
The collective consciousness, collective medical thinking or consciousness has evolved in that direction over the past 50 years. And I think it's culminated in a way in this past year because every 5 years, the American Heart Association and the American College of Cardiology review the guidelines that they recommend to all the doctors in the country. And these guidelines are actually followed around the world, where the Americans saying about the best way to treat disease. So in 2025, they updated their guidelines for the prevention treatment of high blood pressure, which is considered the number one modifiable cause of heart disease in the country, world, from a modern point of view. And there are two parts, three parts. There's a non-drug area and a drug area. Drug is for more severe cases, but they first recommend that everyone use lifestyle methods to prevent high blood pressure, even if you don't have it, to prevent that. And second, to treat or help to treat your high blood pressure and you already have it. And they went through they had four. So the first one was healthy diet, which is actually consistent with an Ayurvedic diet. They call it Mediterranean diet, but it's a plant-based whole food diet, which is consistent with the main Ayurvedic principles. It's not as personalized as the Ayurvedic diet.
Right.
In a general way, it's there. The second, they talk about physical activity, which is consistent with Ayurveda. They don't personalize it again, but physical activity is there. And then the third area, which is the first time they brought in the third area, they say, okay, 50 years of research has shown that the mind influences blood pressure. And that was the first time in 50 years that they acknowledged that in that particular document. They said, okay, the collective zeitgeist, the collective consensus is now at this point. And then part B of that was, okay, if stress or the mind influences blood pressure, what are we going to do about it? And we should do some kind of stress intervention. And then they reviewed the published research, modern research on stress modification, stress interventions for high blood pressure. And they found that the evidence for transcendental meditation was the strongest of all the stress management interventions for low blood pressure. And they rated that and said that this was the strongest of the available evidence that we reviewed. They mentioned yoga there too. It was less strong evidence because it's more variable in how it's taught. And so the evidence is not as strong, but it's there, which is in the direction of classical Ayurveda, which includes classical yoga when practiced properly.
Well, I just want to add, Robert, that they did a very serious deep dive into all the research on any type of meditation, as well as I think biofeedback. It was they did quite an exhaustive review on the research that is out there behind all of these techniques that uh, they claim to have a stress reducing uh, impact. And I just want to point out that really it was your research that they went back and found that, sometimes there's this idea, well, we have to have absolutely brand new research. If it's older research, it doesn't count. Your research was so strong and so it is based on hard measures, again, long-term hard measures, that they had to say the strongest research out there showing the ability to deal with high blood pressure prevented is transcendental meditation. Of course, they said in conjunction with all these other good things. And of course, Ayurveda acknowledges that. That's why Maharishi brought out Ayurveda, so that we're working to gain higher states of consciousness and long life, healthy long life in higher states of consciousness from both the angle of the mind through transcendental meditation and through taking care of the body and making proper choices in our lifestyle. So there it all is, but I just really wanted to highlight this because your work has been so significant in helping this paradigm shift that it has begun to truly happen within modern medicine. So really huge congratulations on that.
Thank you. And like when someone gets an award for the Emmys or something, I want to thank our 12 institutional collaborators around the country, our co-investigators, and all these scientific institutions, and U.S. government for its generous support of his work. They almost said, they didn't quite say you should become enlightened to have a healthy heart, but they're certainly moving in that direction. I would
Beautiful.
say. And our more recent findings have shown related effects. Many people, there are many studies on mental health with transcending, and with Dr. Nidich and our collaborators at the VA, we published on reductions in post-traumatic stress disorder compared to other modalities. So there's a lot of other data there that shows this. And our most recent findings on diabetes. Everyone's very big in the news these days with these new drugs that help diabetes and help weight loss. And that's another interview discussion, perhaps. But, we thought this is such a hot area, and obesity and metabolic syndrome, this kind of pre-diabetes condition, affects a high percentage of adults, U.S. adults. Half of U.S. adults are overweight and many of them have these associated conditions related to blood sugar and prediabetes. So we actually looked at that in some of our studies, one particularly on women, high-risk women, and at 2 sites in Washington and Atlanta. And we showed improvements in diabetes, blood sugar, and insulin levels. And in the subgroup for overweight, we found reductions in weight as well as in these diabetes markers. So it looks like we always predicted that, but now we're documented that the experience of consciousness affects the whole body and the whole mind. And you can pinpoint those effects with these different measures.
Well, what is so beautiful is that all of this confirms the paradigm upon which Ayurveda sits. And that is intelligence is primary and matter is secondary. So this underlying field of pure consciousness or pure intelligence is what gives rise to matter. And therefore, when you open the awareness and infuse that value of pure consciousness into the mind and enliven the healing intelligence that gave rise to all the structure and function of the physiology in the first place, then you have the most powerful way to affect physical matter, because consciousness or intelligence is in fact primary. And so all of this science is helping to wake modern medicine up to the fact that it sits on the wrong paradigm and that they can try to do a million different things, but it's like rearranging the deck furniture on the Titanic. They have a fundamentally incorrect paradigm upon which they're building their observations and their perspectives. And as they begin to shift, and you see it happening because it's shifting through their own research and what their own research is telling them, this is going to lead to a whole paradigm shift, which actually has already been established by physics and modern science. There's an amazing movie out there, The Story of Everything, came out recently. It's fascinating. Everyone should go watch it because, again, it's just displaying all the scientific research that has already established intelligence is primary, matter is secondary. So for all good things to blossom in our life, we have to come back to the source of life, which is pure intelligence, pure consciousness itself. And the human physiology is uniquely structured to open for the individual mind to open to that cosmic intelligence and infuse that value, that power of evolution into our life to live healthy and fulfilling lives. So it's very exciting, Robert, and you have been so instrumental in helping that paradigm shift happen.
Thank you. You could say that the body's inner intelligence cares about whole body and whole.
That's a beautiful way to put it. You're making me laugh. Okay, so let's open it up for questions.
Please let us know when your new Ayurveda textbook is coming out. Looking forward to it.
Well, thank you. Yes, Principles and Practice of Integrative Ayurveda, published by Oxford University Press, should be out this summer in August. It's meant for health professionals and all students of integrative health and Ayurveda. It's really taking this complete knowledge of health that's been taught for the most part from a traditional perspective, and we're maintaining all those principles, but in the light of modern science and modern medicine, and in the consciousness paradigm, which has so often been forgotten, even in modern practice of Ayurveda. It's not just herbal medicine, it's
Right.
caring for the whole person and the whole society also. So it's from that whole health perspective Dr. Nader writes the introduction, and we have some famous Ayurvedic people there. And then we correlate with modern medical understandings, and we show how Ayurveda expands modern medical understanding, particularly in these personalized ways.
Right.
We talked about high blood pressure. That's been a topic today. Modern medicine does recommend lifestyle and medications, but doesn't personalize that care to the type of your mind body type, for example. So that's after the wholeness, we also get personalized. So this is whole person prevention oriented personalized care coming out in this unified framework, really for the first time in the modern era.
Fantastic. And Dr. Schneider created this for the fellowship program at MIU, which is a degree program for healthcare professionals where they can start to integrate Ayurveda into their practice. And also, Maharishi International University has a BA program in Ayurveda and a master's program. And of course, this textbook will be very relevant in all of those programs and utilized in those programs. And so, anyone who knows of people who are interested, health professionals, or even people who just want this knowledge for their own uh, for their own support of their health and well-being, these courses are fantastic, and you can just go to miu.edu, Maharishi International University, and see all the degree programs. MIU is accredited, fully accredited by the, I think, the Midwest Accreditation Committee through the PhD level. So these are accredited degree programs that can be obtained in Ayurveda. The only degree programs, accredited degree programs in Ayurveda in the country. So, and Robert has been very instrumental in all of that over these years.
Always fascinating to talk about consciousness and matter. In regard to the relationship between consciousness and heart disorders, are there heart problems arising when lipids, etc., are good and there's no plague? I'm thinking maybe of neurological disorders or movement disorders, or there's disorders of autonomic system. To me, neurological disorders seem more closely connected to the level of consciousness. Could Dr. Schneider please comment?
Right. So to summarize the questioner seems to be asking about, is consciousness and state of mind more related to neurologic disorders than heart disorders? Is that what they're saying?
Correct.
You see, the consciousness from this Vedic perspective is the basis of the whole body. And even in a more limited perspective, if we think of the brain as a material expression of consciousness and as a direct material expression, the brain and the nervous system goes to every part of the body. Nerves now regulate the gut is a very hot area now. Brain gut, brain heart, brain immune system, brain endocrine system. So actually all the systems in the body are regulated by or strongly influenced by the nervous system. So I would not say that diseases in the nervous system are more related to states of mind than others. Actually, I think the heart areas was the first, and still, maybe I'm biased, but I think the strongest data is there. Mental health is certainly related to mental health. State of stress is related to mental health. Depression, anxiety are all related to stress. So I think that the field is expanding very rapidly. Now there's psycho-oncology, which is a field that talks about how cancer, I'm not saying the mind is the exclusive cause of cancer, but the psycho-oncologists are saying that the state of mind contributes to cancer progression and cancer healing. So this is an emerging, burgeoning area of of medicine now. The older word is psychosomatic medicine, which is mind and body. There's a kind of a newer word. There's two newer words. The second newest is biopsychosocial. Biopsychosocial. And then they added spiritual, biopsychosocial, spiritual. Because even what modern medicine views as spiritual health, the sense of meaning, purpose, and transcendence, is now gaining acknowledgement in modern medicine. And then the newest term, which you see around now, is called whole health. The whole person. The whole person's influenced by the whole person, or the whole person needs to be considered if one wants whole health. It's an emerging developing area, but that's the latest news from the front lines.
Good news. Excellent news. Really wonderful. Just one comment here. At the Raj, we offer meditation. You know, when people come, they can learn transcendental meditation, our meditation of choice, because we feel it's most aligned with the Ayurvedic texts. And at the same time, with Panchakarma, that is the ability to go in with these deeply rejuvenating and healing therapies and basically remove the plaque that has built up, the you could say it's referred to as ama, but toxic residue that builds up from poor digestion when food isn't fully digested. That begins to have its impact on the joints. That substance lodges itself in the joints, and you start getting that stiffness in the body over time. It goes in and balances certain aspects of these fundamental principles that govern the functioning of the body, that put everything back into a nice homeostasis, a nice balance, and it pulls out the environmental toxins that we're plagued with today that are ubiquitous: food, air, water, and are also interfering with the natural flow of intelligence in the body. So it's in terms of whole health, that's what Ayurveda offers. So it goes in and it sort of cleans up the situation, then provides you with all the right choices that are very personalized, as Robert was just talking about. It's a very personalized approach to health and well-being. So someone where they come in and say, well, I seem to have diabetes, and someone else comes in and says, I seem to have diabetes. Ayurveda looks at root cause and isn't going to make the same prescription for lifestyle choices necessarily in both of those cases. So very personalized medicine. And then there you are. You've got a kind of new lease on life. We've done a great job in sort of cleaning up the damage that has been done to some extent. And then these transcendental meditation, you begin to enliven the field of consciousness, pure intelligence in the matter that structures your body and governing that matter. And then you have all the right choices from your consultations with the Ayurvedic experts who can tell you very specifically now how you maintain and build on the foundation that you created. So I just want to bring this in because as Robert was talking about whole health, what does that look like? Whole health care, caring, whole health caring. What does that look like? What does that look like? So I just wanted to give a little bit of a kind of insight into how that works.
Hi, Dr. Schneider.
Hi.
I'm really enjoying your talk, and thank you, Rajradeshri Canvas, for holding it. Yeah, I just was doing a little research on heart disorders, and my question was related to the fact that there are people who have good lipid panels, good tests, no plaque, and yet they can have big swings in blood pressure or, perhaps people with neurological disorders, and it doesn't show up in tests. They don't know they have neurological disorders. Is that possible to still have heart disease when all your tests are good?
Yes, it is. Actually, it's a really famous or active area now, particularly in women's heart health, also in men, more in women. They can have heart attacks without coronary occlusion. It's called MINOCA, myocardial infarction with no coronary occlusion. You can also have angina, chest pain with no coronary occlusion. So you look in the arteries, you squirt in the dye, and you look at them, they're open, they're clean. But these people are getting still heart attacks and chest pain. So it's surprising, the old-fashioned idea. I mean, still people get blockage. There are many people still have the regular old blockages. But there's this whole new category of it's thought to be functional rather than structural. It may be that the arteries are constricting. It's more functional than a structural blockage. And psychosocial states, stress may be even more related to the arteries constricting.
Mhm.
Actually, if you want to get a little fancy, there's something called broken heart syndrome,
Yeah.
which you may have heard about. So people, all of a sudden, out of the blue, there's this heart failure, and they go to the hospital and they look at, and their arteries are clean. But there was some major trauma, psychological trauma in their lives,
Emotional, right.
emotional trauma. And it's as they are having a kind of heart attack. And then, you treat them, they feel better, they get more relaxed, maybe they start meditating, and then the situation clears up. So,
Mm.
yes, there is this newly, it was always there, but newly discovered. In the past, certain groups were underserved, under-researched, understood. Uh, Many people would say they feel understood. So this is a case of that. And they're discovering there is a physiological basis that's a different cause. The same generally reduced blood flow, but from a different functional perspective. And they can have normal cholesterol. Actually, I think something like a third of the people who have heart attacks have normal cholesterol and normal blood pressure. So those are not absolute. They're certainly risk factors, but they're not guaranteed factors. And there are many other factors as yet undiscovered by
Yeah.
modern medicine, which I believe that Ayurveda, in its more comprehensive knowledge, understands better, and has been talked about for millennia, taking care of the whole person rather than just these particular biochemical elements. Does that
That
speak, Tricia, to your comment, your question?
Yeah, thank you very much, Dr. Schneider. I just remember this several things. We had many years ago a very good speaker, a very inspiring speaker, a woman from New York. She was
Yeah,
a cardiologist. You will
wow.
probably remember her name, but I can't. But
is
That's
it
she was
Suzanne.
yeah.
she was talking about many women saying they think they have a heart problem, and they're sent away, and they die of a heart attack. But how are they testing now for this kind of thing? I know of a friend who has big swings in blood pressure, and he says, "Oh, this is a neurological disorder or something like that." But I was just very interested in that. How do you test? Yeah, thank you.
Yeah, there are newer methods. This is women's heart health is really an exploding area now.
Mm.
You can actually stimulate. I mean, you can actually stimulate the arteries under laboratory conditions and see what happens to them. It's kind of a stress test in the laboratory. It's not fully developed. At least it's acknowledged now. It's an active area of research in modern medicine. But I would say prevention. Take your deep physiological purification therapy as a prevention measure. Rasayana therapy, this kind of comes back to the theme of the in Ayurvedic language, it's called rasayana. Rasayana means prevention and longevity, promoting. So meditation, particularly transcending type of meditation, is rasayana, is anti-aging and holistic in its effects. Cleaning out the channels, cleaning out the impurities, the technical word is panchakarma. The concept is cleaning out the channels, cleaning the impurities, ideally on a seasonal basis, once a year or twice a year or seasonal. That's another rasayana. Mental health in general is part of this whole area of Vedic mental health is rasayana. Also, lifestyle every day is how you handle your lifestyle is part of rasana achar or behavioral rasana, how you behave. And I would recommend that women and men both attend to prevention while modern medicine is discovering all the new.
Getting it figured out.
While they're figuring out, I suggest these preventive measures and watch how science continues to understand and elucidate and verify these kinds of modalities.
Beautiful.
Thank you so much, Dr. Schneider. Thank you, Roger, Jeshri Canvas.
Thank you, Tricia, for such great questions. Brought out really great knowledge here from Dr. Schneider. So, and Robert, I also think about that deeply blissful, fulfilling experience that comes over time with practicing, or even sometimes immediately, practicing transcendental meditation, and that kind of nourishment that it gives to the heart and to the whole physiology. Because I think really for women, this is such an incredibly important insight, because that emotional component is such an essential aspect of our uniqueness. And of course, it's because we could say one reason, we're hardwired, or we're made to give birth to children and to provide that nourishing process for that infant to become an independent, healthy, psychologically and healthy member of society. So we're programmed for a very specific role, whether we have our own children or not. But that emotional component, that ability to give love, and of course to receive love in return, but to give love is so essential to who we are. So you can imagine when there are restrictions to that kind of flow of feeling, to extend ourselves in love and appreciation, and then situations come up in our life where we begin to feel we have to protect our feelings. We have to sort of build up a wall around our heart to protect ourselves. And then our heart can't flow spontaneously and easily in that nourishing value. This is a really fundamental thing that modern medicine has not really quite begun to get its mind around, you could say. But these subtle levels of life, Ayurveda understands this so deeply, addresses this so deeply. And just by finding that abiding inner happiness within ourselves, to find that self-sufficiency in that field of the self and that eternal universal identity of who we are, it just saves everything. We find the ability to take down the stresses that have built up around our hearts flowing in love and appreciation, those defenses that we've developed so that everyone does this so that they're not hurt. And to be able to remove that stress, to be able to open up that inner field of happiness and just let it infuse not only our mind and heart, but our whole physiology. I know some of the guests at the Raj have said that when that one treatment, where they just pour warm oil over the whole body, it's just being drenched. They said that the minute that treatment starts, they feel like every cell in the body is happy. It just knows what's coming, and every cell in the body is happy. So happiness is a physical, emotional, psychological reality that is actually our birthright. So this is what Ayurveda is completely structured to do. Just bring us back home to who we are and let that intelligence of nature and the light of God to just permeate our existence. This is life as it's meant to be. This is life in higher states of consciousness, and this is perfect health. So, Robert, we're just so grateful to you today for just making this connection to science and pushing beyond the modern medical framework to see where we're going, where life is going, where the whole paradigm shift is moving towards. And we really want to just acknowledge your role in making that happen. And thank you very much.
Thank you. Thank you for bringing the light of understanding, knowledge, and love and experience to this show and generally.
My joy every month to share whatever we all have that we can share with everyone out there. It's so time. As Maharishi said, everyone should be able now to take their health and their happiness back into their own hands. So we've gone a little bit late. Do we have any other questions that look like we just wouldn't want to close without answering them?
As we age, our hereditary genetic factors become more activated. How does consciousness help neutralize this factor? Also, astrological factors, which are usually linked to hereditary factors.
Great questions.
Right. It's not that genetic factors become more active with aging. They're always there from the moment of conception. Uh, Actually, aging begins at conception. Aging begins prior to conception. But we can think of conception, we could think of birth. Um, if we define aging as change over time, happens all the time. From the Ayurvedic perspective, but people complain or experience unwanted effects of aging later in life. And Ayurveda talks about accumulation of imbalances over time. When you're young, you haven't accumulated that much, sort of young depression. Over time, if you don't remove the toxins, if you don't clean your system, if you don't maintain balance, then it accumulates. And that accumulation of imbalance, it becomes more and more visible over time. It can be because your resilience, it's imbalance versus resilience. When you're young, you have more resilience, less imbalance, and then that can shift. So prevention is actually a lifelong process. Should start at birth. Actually, should start before birth. There's a mother-baby program. There's a pre-pregnancy program in Ayurveda for parents to prepare. So aging is a change over time, and if we don't prevent. However, the good news is that one can intervene at any stage in that process. There have been studies with older people over 60 and changing their lifestyle or intervening in some way. So there's still modifiability even later in life. It's hardly ever too late to intervene. Actually, it's never too late to do something to enhance the process. So intervention is always possible at any stage. And of course, the earlier you start, the better, but start anytime.
Great. Robert, you have just been such a wealth of information. I learned so much in this interview. I'm very grateful. And we'd like to have you back on some other specific topics. Really go into aging would be fascinating. I know you've done a book on it and you really have a lot of knowledge in that area. So if it's all right with you, we'll have you as a repeat guest. And this has really been wonderful. And there's so much interest now. The paradigm is really, really shifting. I ended up speaking at the Health and Human Services National Convention on Women's Health in the middle of March. It sort of happened all at the last minute, and there I was on this huge stage with a panel discussion, but talking about Ayurveda. This is a government conference. And I was sitting up there just thinking, this is like a miracle, really a miracle. So I think also the American Association of Physicians of Indian Origin, they're really interested now, here, those doctors of Indian origin in the US, really in kind of getting back to their own tradition and understanding more about Ayurveda. And I think it would be wonderful for you to speak with them in the context of their Ayurveda consortium. And also with, we've been working as together with Mayo Clinic's alternative Department of Complementary and Integrative Medicine. And that I think they would like you to do some in cardiology, some grand rounds. So I think there's so many opportunities today to really, so much openness to Ayurveda now. We have a lot to do. So it's exciting time.
All the best, everyone, and all the best for health, wealth, and wisdom.
Thanks again, Robert. And thanks everyone for joining, and we'll see you next week. I always say next week, next month. Looking forward to seeing you next month. Thanks again, and bye for now.